Hello, and welcome to Nephrology Nursing Perspectives, an official podcast of the American Nephrology Nurses Association. This podcast provides interviews and discussions between members of the American Nephrology Nurses Association and the nephrology community. The podcast focuses on nephrology nurses' issues, health policy, and nephrology nursing as a specialty nursing profession in the areas of conservative management, peritoneal dialysis, hemodialysis, continuous kidney replacement therapies, acute kidney injury, transplantation, industry, and health policy. On August 31st, 2021, Mr. David Walz, the 2021-2022 President of the American Nephrology Nurses Association, provided a State of the Association address. During his address, Mr. Walz updated association members and the nephrology community on the strategic planning session held during the July 2021 ANNA Board of Directors meeting. We are pleased to present Mr. Walz's important State of the Association address.
Welcome to the first ANNA State of the Association. I am David Walz, your ANNA President. This past July, the entire board of directors, along with national office staff and facilitator Brian Riggs, conducted strategic planning for ANNA's next 2 to 3 years. Survey responses and interviews with ANNA's members, leaders, stakeholders, and national office staff informed the strategic process. I'm going to share with you an overview of the initial 3 focus areas, which include infrastructure, brand, and people, a goal statement per focus area, and the supporting strategies that emerged from the strategic planning. The strategies are to be considered year 1 efforts. Additional strategies and tactics will be added by the board of directors in the couple months from now. The complete body of work for this strategic planning session will be placed into a 30-page document, inclusive of interviews, survey results, in-session images, transcriptions, and recommendation tactics, and will be available to the membership via the ANNA website after the entire board reviews the plan at our meeting in September. The first focus area I will comment is on infrastructure. Our supporting statement is to fully serve our members and to prepare for an ever-changing landscape within our society. ANNA will focus on reinvesting in and the redesign of its foundation to be more innovative, inclusive, and accessible. Our goal is that over the next 36 months, ANNA will reinvest in the infrastructure of the organization by improving its technology, systems, and processes, while also evaluating and investing in its people, including staff, leadership, members, and additional stakeholders. ANNA will also invest in the infrastructure to reach individuals who are not members, but access products and services provided by the association. Our initial strategies include evaluating the current state of operations, including processes, staffing, systems, through the organizational assessment. ANNA will start by conducting a SWOT analysis of the web design with a goal of future redesign to improve ease of use, functionality, and intuitive design, access of our current offerings, and efforts to ensure relevancy to our audience, access to our current governance model, including volunteer leadership model, membership model, to ensure it meets the needs of our current landscape, and create a new organizational infrastructure and system to support a potentially different model for ANNA. The second focus area is our brand. ANNA brand must continue to be recognized brand within our society or specialty. It should be relevant, identifiable, contemporary, and seen as a value resource in the profession. Our goal is that ANNA will increase its visibility within the industry and among the public by enhancing its brand experience, and brand assets. To accomplish this, we will deliver a new experience to our stakeholders through the modern experience, increase accessibility, focused on educational offerings, and industry-wide representation. ANNA has invested in a module-based nephrology nursing certification review course that addresses the CNN nurse practice, and the CDN examinations. This course will be launched in October of this year. In 2020, spring of 2021, ANNA developed 3 fully virtual national conferences out of the necessity due to COVID-19. And next month, ANNA will deliver its first hybrid nephrology nursing practice management and leadership conference in Hollywood, Florida. This hybrid event will allow in-person and virtual attendees to conduct and engage with each other on a unified platform. Hybrid education offerings is the way of the future, and ANNA has moved into this space and will continue to refine the processes for our attendees. Our initial strategies include conducting a brand and content audit, inclusive of visual assets, communication plan, and member-focused content to serve as the foundation for a gap analysis for the new approach to communicating to our stakeholders. Redesign of ANNA's public-facing brand assets and experiences to ensure they are relevant, clear, and accessible. Another example of contemporary way ANNA will be getting its information into the hands of the stakeholders. And a symbol of a communication strategy aimed at increasing the awareness around nephrology and kidney disease within the nursing community and to the public. The last focus area is our people. Our stakeholders are the future of the association, and we are dedicated to supporting our network, providing access to educational resources, engagement opportunities, and ongoing professional support. Our goal is to support the experience for all stakeholders through a better understanding of our membership, enhancing the diversity within the association, and a holistic approach to individual and professional development. Our strategies are to map the current member experience, new, existing, and future, to identify opportunities for innovation and improvement. ANNA recognizes there is a reach to non-ANNA members who access services and products. Reaching this population may never desire to be a member, but obtain educational resources needs to be further developed. To expand our membership by first understanding our key demographics and then addressing our needs across multiple areas based on that understanding. To audit our membership data to create no less than 5 member personas. These personas will drive our communication, engagement, and recruitment efforts. Develop annual retention and recruitment campaigns, template reflective of today's post-pandemic landscape. ANNA is aware that the pandemic has changed the landscape for nephrology nurses and the way they engage with each other, an association, and acquiring education and professional resources. These factors will be taken into consideration as recruitment and retention programs are developed and implemented. And to establish a grassroots marketing campaign to create a button-up, groundswell approach to raising awareness of our community. In closing, ANNA is committed to its members, and I quote Wilson Kandai, "To be the best, you must be able to handle the worst." I hope that pandemic is the worst that we've experienced, and as we have positioned ourselves to accomplish great things here in the future. We have much work to do, and I'm confident in the direction of ANNA. To all the nephrology nurses, with September comes Nephrology Nurses Week, September 12th through the 18th. On behalf of the entire board of directors, the national office, fellow colleagues, and patients, thank you for continuing to rise. Thank you for your commitment, your professionalism, your perseverance. Thank you for making a difference with your skills, knowledge, and dedication. Nephrology nurses, I see you. I look forward to seeing many of you at the ANNA Fall Conference in sunny Hollywood Beach, Florida, soon, September 17th through the 19th. Stay well, be well, and good night.
Nephrology Nursing Perspectives is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Mr. David Walz is the Director of Centra Care Kidney Program in St. Cloud, Minnesota, and the 2021-2022 President of the American Nephrology Nurses Association. For archived episodes of this and all ANNA podcasts, and to learn more about the American Nephrology Nurses Association, visit annanurse.org. You can subscribe to Nephrology Nursing Perspectives, NNJ Extra, and ANNA's 50th anniversary podcast series on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.